As a radiology student, there are multiple safety precautions and principles we are expected to follow closely. Adherence to those principles will not only ensure the lowest exposure rate, but it will also build a strong foundation of radiation protection for our future career. In the earliest years of experimentation with radiation, pioneering scientists did not yet fully understand the hazards of radiation. Today, it is understood that radiation does indeed carry adverse effects, with the World Health Organization deeming it as a carcinogen. Risks of overexposure to radiation include cancer development, birth defects, and cataracts. To ensure high-quality patient care and safety of imaging personnel, it is crucial to implement safety practices. While radiology in the imaging field is deemed a safe occupation, every student radiographer has an obligation to protect themselves and their patients from excessive exposure. This is not to say that one should not try their best to obtain diagnostic images. This means that these specific safety practices should be followed in order to decrease the amount of exposure to the patient and radiology worker. Appropriate precautions are employed during the use of X-ray equipment, including ALARA, which means as low as reasonably achievable, and the 3 cardinal rules for radiation protection: time, distance, and shielding. By decreasing the time of exposure, increasing your distance away from the radiation source, and shielding, operators can effectively decrease their amount of exposure. At SCC, our protocol is to shield everyone 60 and younger. Common types of shields available are lap shields or mounted shields. Shielding must be done in a manner not to obscure what needs to be imaged. Each clinical site that we rotate to will have different shielding policies, so be sure to ask if you've never been to a site before. SCC protocol also states that radiology students must ask every female patient from ages 10 to 60 years old if there is any chance they are pregnant before their exam. It is important to know that radiation does impact fetal development in the womb, with the first trimester being the most radiosensitive and susceptible to damage. In exams where we are not able to leave the room and do not have the ability to stand behind the lead wall, we as radiology students need to wear lead aprons. A minimum of 0.25 millimeter lead equivalent thickness is standard for use during fluoro procedures. To provide appropriate protection to the neck and thyroid region, thyroid collars should have a minimum lead equivalent thickness of 0.5 millimeters. The maximum dose allowed to the thyroid is 500 millisieverts per year. A thyroid shield can decrease a total exposure by approximately 50%, so don't forget it. Situations where we will be wearing lead aprons and thyroid shields include the operating room, joint injections, non-sterile procedures, fluoroscopy, and in the cath lab. During fluoroscopy, make sure you are distancing yourself from the primary beam and from the patient as much as possible while still assisting in the procedure. It is recommended to stand far away or even behind the radiologist. Additional protective equipment can be used in fluoroscopy, like lead drapes and lead gloves. As students, if our hands are near the beam of the X-ray, lead gloves must be worn. As a radiologic technologist, we are in charge of the radiation safety for everyone in the room of the procedure. So in situations like surgery, fluoroscopy, or procedures, it is your job to make sure everyone in the room has a lead apron on before you start using the C-arm, or the X-ray machine. Radiology students are also required to wear their lead on all mobile and portable exams. Ensure that any bystanders, like family members or nurses, leave the room prior to bringing the machine into the room. When taking the exposure on a mobile unit, make sure you stand at least 6 feet away from the X-ray tube, with bystanders a minimum of 12 feet away. If the patient has a contagious disease, or if the exam is expected to be messy, you will need to wear a protective isolation gown in addition to your lead. You will put your lead on first, and then your gown on top of the lead. Just be sure to remember while wearing lead, your radiation badge is on the outside of your apron. This way, it will ensure accurate data recordings. At the beginning of each quarter, each student will be given what's called a radiation badge, or a dosimeter. Wear your radiation badge at all times in clinical, as this tracks how much radiation you are exposed to. These are worn at collar level outside the lead apron. Make sure you don't leave your badge on the apron in the room or in places where they can absorb radiation, like for example, your car on a hot day in the sun. At the end of each quarter, a dose summary report is made by the safety officer and given to each student to review their exposure dose. The adult radiology worker has an annual dose limit of 50 millisieverts per year. However, if the student receives 4 millisieverts or higher during the 3-month quarter, they will need to meet with the radiation safety officer. Don't worry though, if you are following the protocols correctly, you as a student should not come close to reaching 4 millisieverts within a few months. In fact, only 0.05% of technologists max out their annual dose limit. No acute effects from radiation occur at doses less than 1 sievert, which is 20 times larger than the annual dose limit. If you find yourself pregnant while in the radiology program, be sure to adhere to the student handbook, speak with the radiation safety officer and instructors to understand the options available as well as your risks. Pregnant radiology workers wear 2 radiation badges. The first is worn at your chest to track your own radiation exposure. This is worn, again, outside of your lead apron. The second badge will be worn at the level of your abdomen to track radiation exposure to the baby. This fetal rad badge will be worn under your apron. The dose limit for the pregnant worker must not exceed 5 millisieverts for the entire pregnancy, or no more than 0.5 millisieverts per month. Pregnant workers are required to wear wraparound leads. These wrap around your whole body and offer more thorough protection. These will be available at all of your clinical sites. Data shows that with proper shielding, monitoring, and protective practices, pregnant women will not exceed allowable radiation exposure limits, even in high exposure modalities using live fluoroscopy. At times, it is necessary to use relatives of the patient or other paramedical personnel to hold the patient when the exposure is taken. However, a student should refrain from holding the patient during a radiographic procedure. Instead, utilize the tools and equipment around the room, like sponges, tape, and sandbags, to immobilize the patient for their image. In some cases, the tech you are with, a nurse, or even the relative can hold the patient. Just make sure they are wearing a lead apron. A student radiographer can never hold an image receptor during an exposure under any circumstance. Instead, use a grid holder or other tools in the room to hold the IR in the proper position. The technologist will wear a lead apron and hold the board if absolutely necessary. You will see this commonly in mobile examinations. Good practices you can follow to decrease exposure will be to always collimate to the smallest area being studied. This will cut down on scatter radiation and exposure to other body parts that are not being studied. Limiting scatter will also in turn improve the quality of the radiograph. A good rule of thumb to follow is to collimate within 1 inch of the anatomy of interest. When selecting a technique for an exam, use technique charts as a reference. School KVP should always be used, so make sure you always have those memorized. As students, we should be looking at the exposure index or the deviation index after each exposure. This really helps you learn proper techniques to use. All X-ray machines have a standard aluminum filter to cut out the ineffective and poor quality irradiation. Don't remove this filter for any purpose. If you suspect something is wrong with the equipment, notify the lead technologist, instructor, or program director. It is always better to ask questions than not. In the event of a radioactive accident or a spill of radioactive materials, refer to the Hazardous Material Manual and contact the radiation safety officer immediately. Remember that you, as a student radiographer, are a professional person who will be exposed to small amounts of radiation throughout your career that you are just beginning. The effects of radiation are accumulative, so it is important to become diligent in safety protocols as a student and remain steadfast throughout your career. The International Radiation Protection Association advocates the embedding of radiation safety at a cultural level in an organization. The correct culture and teamwork atmosphere will support proper patient care and safety practices.